A true humanitarian. Ladies and gentlemen, a very warm Sunshine Coast welcome.
Saturday afternoon when you could have been at home or shopping or putting your feet up, reading the paper. So I kind of get the feeling that Sunshine Coast is just sort of a hotbed of radical politics. Lots of people I've met in the day I've known for 20, 30, even 40 years from either East Vancouver or Vancouver, longtime activists. So this is where you hang out, the Sunshine Coast. So it's very good to see everybody. And Terry, thank you so much for your introduction. My mom is 95 this year, and she still lives in her own house. And you know, she's getting a bit fragile, but she's totally together, as Terry knows. And Terry often goes to visit her, so she will be just delighted that you were the one who introduced me today, because I'm going to see her on the way back home. And to Larry, where's Larry? There you are. I just want to say, you're an awesome candidate. I mean, reading about you and what you've done in this community, folks should be very proud that you're out there for the New Democratic Party. And when I read a little bit of your background, and he says, my grandfather joined the CCF in 1933, my father in 1939, and at the age of 100 years old is still a member today. And Larry says that in his home, politics were always front and center, and that he grew up listening to the great speeches by Tommy Douglas, Roy Romano, and Alan Blakey, and others. And I thought, oh my God, I'm going to be like, you know, third tier here. But so you obviously grew up with very fine politics in Saskatchewan. So I'm very, very happy to be here today, and especially to see my good friend and provincial colleague, Nicholas. There he is. It's true. I think the second thing I said to him was, how do you actually get here? You know, I'm very interested in travel, and Nicholas, we absolutely have something in common, because I too get hounded about my travel, if you can believe it. And I just got queried by the Hill Times in Ottawa. Thank God nobody here reads it, I don't think. And they said, Libby, you're the 5th highest spender on travel or something in Ottawa. Like, what is that about? And, you know, here I am explaining. I go back and forth to my riding pretty well every week, and I go other places to speak, and, you know, and it does make you feel a little bit sort of defensive. And it is public funds, so we have to be accountable. And the fact that it's disclosed is the way it should be, and I'm very glad that it is disclosed. But whenever you get a phone call about your travel or your budget, you kind of go, oh, you know, was she really bought that coffee maker? Anyway, we get through it, right? Yeah. So again, I'm just so happy to be here today. And this is, as Larry has said, this is not an easy riding federally. As Terry and others know, because one, is enormous, and two, you know, it's getting around and getting known is not an easy thing to do. So I'm very lucky in East Vancouver. I can go from one end to the riding, you know, in 25 minutes, and it's dense, and I can zip around and do my thing. So I certainly wish you well, Larry. But I do want to say that, of course, we're going to have a federal election this year. And in BC, it really is about the NDP and Conservatives. You know, if you look at the politics in this province, in just about every riding we have where the Conservatives have won, who comes in a very close second, in some cases by a few hundred votes, it's the NDP. So the battleground is very clear here. And I do want to say that nationally, you know, we just finished our national caucus meeting in Ottawa a few weeks ago, and I felt so proud to see all of my colleagues gathered after the summer You know, we have almost 100 members in our caucus. And sometimes I read the media, the mainstream corporate media, as opposed to Rabble.ca, where my partner Kim, who's here today, is the publisher. That's where you get the real news. But when you read the mainstream media, you think, wow, does the NDP even count? You know? Like if you read it day after day, the columnists and the various stories, and you look at polls and you think, wow, like what is going on here? And yet what I experience and what I know from many elections, what I know about the NDP and the passion that we have about our politics and the place that we have in our society, my God, if it weren't for New Democrats and the CCF over many decades, we wouldn't have Medicare in this country. We wouldn't have pensions in this country. We wouldn't have co-op housing and social housing in this country. And so when I look at the history of who we actually are and what we do and the passion we bring and what we believe in, it isn't just about a little platform at election time. It's actually a deep belief in who we are and the fact that we are part of a bigger social movement. And that's something that I've always believed in very, very, very strongly. You know, yes, elections matter. We run to win. We want to put candidates in every riding. We want people to know that when you vote for a New Democrat, you vote for a real program that is progressive, that has history, that has roots. But I think what's also important is the work that we do between elections, the work that we do in our local communities. And one of the things that I've come to know over the years is that you won't ever find a more hard-working member of parliament, or MLA for that matter, than a New Democrat. And the reason is that we often scrap. We fight tooth and nail to win our ridings. And again, we put ourselves forward, and I know that's why Larry is doing it. It's not about building a career. It's not about, you know, you want to be in the power game. It's because we believe in something. We believe in something about our society. It's based on democratic values. It's based on progressive values. It's based on compassion. It's about believing that the role of government is something there to improve the good of all people. It's not just about... If you ask people 20 years ago, what is the purpose of government? Most people would say, well, you know, it's to make sure we have health care, it's to make sure we have education, to make sure we have safety. And I think people would also say it's to make sure that we have a society where people are not just abandoned, as we see in so many other countries and governments. And there is that kind of deep belief about what the role of the state and the government is. But of course what's happened over the last few decades over liberal and conservative governments is that the role of government has completely shrunk to almost nothing, where now it's an intervention, whether it's just on defense and foreign policy, which has become more about trade, and it's really become that the role of government is about breaking down regulations, about privatization, and about creating new markets for big corporations. I mean, that's a massive switch that's happened over a number of decades. And what's gone along with that has been a changing taxation system too, where people actually, and I think many of you, and I know many of us still believe that the purpose of taxation, again, is to create those greater societal benefits, right? I was listening to a debate on CBC the other day, and it was a young woman and a guy who were talking about whether or not post-secondary education should be free. And of course, one of the people was arguing that no, it shouldn't be, that it should be based on, you know, if you're wealthy, you pay, and if you can't afford it, well, maybe you should get, you know, some kind of loan or something. But it seems to me that these are very basic values about what we believe in a society and the greater good. I mean, who would argue that we shouldn't be funding public education from K to 12? Who would argue that we shouldn't be providing and ensuring that every Canadian has access to health care? And this is why we generate progressive taxation, because that's where it is based on the ability to pay, and then those benefits can be spread in a more equitable way you know, in terms of demographics and communities and where people are and what needs are. I believe in that. And as New Democrats, we believe in that. And yet somehow, this has now become very unpopular, you know? And I hear it every day in House of Commons, you know, that the NDP is just about tax and spend. That's not it at all. It's about fair taxation. It's about progressive taxation. And it's about ensuring that this country is based on values of equity and fairness and democracy. And that's something of course, that unfortunately Stephen Harper has completely ripped to shreds. Now, I actually did not come here today to talk about Stephen Harper. But I want to say one thing. I do want to say one thing, and that is, undoubtedly, this is the most conservative government we have seen in the history of this country. I mean, I would take Mulroney. As bad as he was, well, okay. I'll take that back. But, I mean, look at what this man has done. We have battled bill after bill in the House of Commons. These god-awful omnibus bills, 1,000 pages, 2,000 pages, where it's meant to be based on what the budget was, and they put everything in, stripping away environmental protection, stripping away, you know, pension protection. It goes on and on and on. So I do have this little kind of dream or vision of my own, and that is that should we be in a position, and I hope we will be, should we be in a position after the next election to be able to craft and generate government legislation, I have this vision of a new omnibus bill. And it will be at least 2,000 pages long. And it will have every goddamn thing that they took out and put back in.
All right.
Well, I want to tell you, I've worked with Mr. Mulcair since he was elected as leader. I sit next to him in the House of Commons. I've been terribly impressed by his experience and his depth of understanding, and I watch him every day as he takes on Stephen Harper. Now, this is accountability when you watch him take on Stephen Harper. And that's we are the official opposition. Can you believe it? We are Her Majesty's official opposition in Canada. Nobody believed that would ever happen. Nobody believed that we would come second in 107, not first, those are the ones we won, but second in 107 ridings after the Conservatives. So the base that we have to go to the next move, which we hope is forming government, this is something that's actually achievable, but you would never believe that if you read it in the media, to come back to my first point. So I want you to believe in who you are. I want you to believe in why you're here and what you stood for over many generations. And I know some of you are long time activists, and not abandon that. And to make sure that Larry, who's a terrific candidate, gets all of the support he needs to give John Weston the boot in this riding, because it is something that's actually... Now, actually, I told Larry that I was speaking about health care. I got a bit carried away there. So I better get on to health care pretty quickly. I have been the healthcare critic, and I came here today as the healthcare critic, but actually as of, I think it was yesterday or the day before, I'm not the healthcare critic. Now this is not surprising, and I'm totally okay with it, because as you know, I'm not seeking re-election, and as Kim, my partner, will tell you, I'm saying to everybody, I'm not retiring, I'm just not running again. And I do believe it's time for a new voice in East Vancouver, and it will be a very interesting nomination race. I love being a member of Parliament, I really do. It's been the most amazing experience of my life. But I first ran in 1976 when I was 23. And I counted up the elections that I've run in civically I was a councillor for 5 terms, on the park board for 1 term, and then there were a few elections I lost. I ran for mayor, didn't win that. So I counted them up, and I actually kind of scared myself, and I thought, wow, like, can I do another one? And I just felt like, you know what, I'm done. I'm not done with politics, don't get me wrong. I'm not done. There's a moment where you think, okay, you know what, it's time for a new voice to come forward in our community. And East Vancouver is a very special riding, you know, and I think of Margaret Mitchell, who some of you will remember. It was Margaret Mitchell who first raised the head tax in the House of Commons. I then took it up when I became an MP. And this, of course, was the head tax at the turn of the century when Chinese workers were denied entrance to Canada and had to pay a ridiculous head tax and faced terrible discrimination. And it took us decades and decades and decades to get redress and an apology for that. It was Jack Layton who was very instrumental in the apology, the official government apology and recognition of the racist colonial history around residential schools in this country. And so again, it just comes back to this role that we play. But on healthcare, I do want to say something about healthcare because I have thoroughly enjoyed being the healthcare critic for our party. And when Jack first appointed me to be the critic, he said, Libby, I want you to be the critic because I want you to go out and organize about it. I want you to go out and make this an issue. I said, okay, all right, I'll do that. I'll do anything for you, Jack, and I'll do that. And so I embarked upon a campaign knowing that what were called the health accords that had begun in 2004 and ended in 2014 were coming to an end. Now these health accords that sort of guided the federal fiscal and sort of policy approach to healthcare with the provinces and the territories, they weren't very hot to begin with, I have to tell you, for those of you who have followed healthcare. In 2004, they were really pretty loosey-goosey. They were sort of general goals that were set about what the premiers and the federal government of the day were going to do on healthcare. But it was better than nothing. And of course, what we've seen with Stephen Harper is that he has really just abandoned healthcare. Like, the delivery of healthcare is a provincial responsibility. You know, that is clear. But there's always been a federal role in healthcare, and it comes as a result of the Canada Health Act. We're not the United States of America. We have a public healthcare system in this country, and it's more than about healthcare. It's about the values we hold as Canadians and how we see ourselves and our neighbors and our community. So in this country, it's a deeply held value that no matter whether you're rich or poor, you live in the north or the south, or wherever you live in a city or a small community, that you should have accessibility to our healthcare system. And that's a very important value that's now being sort of, you know, almost torn down and ripped up by the Conservative government. And so when I took on being the healthcare critic for the NDP, I learned from Jack, and you know, he and I were municipal councillors for many years, and we worked together as municipal councillors, he in Toronto, me in Vancouver, so I knew him for a long time. And so I always, you know, Jack would always say it's not just opposition, you heard him say this many times, it's not just opposition, it's proposition. And you can see him do that in Ottawa. It was always about trying to bring forward constructive solutions. I mean, think of the budget that we got one year with the Liberals, where we were able to put money into education and housing and transportation. And so what I did was I went across the country, we met with groups across the country, and we actually talked to Canadians about our healthcare system and said, what is it that we need to do? And the first thing I did was go back and look at what it was that Tommy Douglas had actually proposed. You know, when they fought for Medicare in Saskatchewan and the doctors went on strike and they almost did him in, but they didn't. I mean, he was a very strong man. He always said, you know, allowing, you know, having people go to the hospital and having coverage at the hospital, that's only the first phase of Medicare, he said. He always said that. And he always talked about phase 2, which was about focusing more on the social determinants of health, like people's well-being, their housing, their income, their education, things that determine whether or not we even have a better chance at being healthy or not. Because some people are born and where they are in a socioeconomic way, they're destined to have very poor health. And we can see that in Aboriginal communities. I can see that in the downtown east side in my riding. And so Tommy Douglas always understood and believed that there was another more important phase of our healthcare system, and that was focusing on prevention and health and well-being and primary care and the social determinants of health. And so when we went across the country, we talked to people about some of these issues. And over the course of about 18 months, we came up with sort of our vision for how we need to sustain and strengthen and expand, not deflate our public healthcare system. And the reason I want to talk to you about it is that it's a huge issue, because we're talking about billions and billions of dollars, whether it's in drug costs, whether it's in long-term care, whether it's in private healthcare costs. This is a multi-billion-dollar industry, and there are people who operate in a for-profit way who would love to get their hands on any single component of our healthcare system. So our job is to make sure not only do we defend our public healthcare system, but that we do make it sustainable and that we grow it and expand it in a way that actually makes sense. And so I have brought along some of the copies of our plan for healthcare, and I really hope you'll take it home with you and read it. Because that plan, first of all, we talk about the federal role. The federal government's not going to run the healthcare system, but the federal government has to set the standard, and it's called money. You know, the feds are now shortchanging the provinces and the territories by about $36 billion in healthcare funding. That's something that we're committed, and Mr. Tom Mulcair has made a commitment to change. We want to see a federal role where we use that transfer to actually make agreements, to have real concrete healthcare outcomes that are agreed to. So for example, some of you might remember that in the Romano Royal Commission on Home Care, they said one of the most urgent things in this country with an aging population is to have home care. You know, there are many older people who end up in hospitals when they shouldn't be there. They have nowhere to go. That's an issue here on the Sunshine Coast. It's an issue in Vancouver. You know, the problem isn't with the emergency rooms. The problem is that there are people who are in acute care beds who really shouldn't be there. They should either be at home with proper professional and not volunteer home care support. Volunteers are fine, but we're talking about professional health care, or they may need to be in what we call a long-term care facility. So these were all sort of promises that were made in 2004 but have never been followed through. Another one is public coverage for prescription drugs. You know, at least 10% of Canadians don't have any coverage whatsoever. And in fact, one of the fastest growing costs in the healthcare is prescription drugs. Now, some of you here are probably covered by pharmacare. Some of you may be covered by workplace extended healthcare plans, and that's good. But there's many people who are not covered. And in some provinces, if you have cancer and they have no kind of pharmacare like we have in BC, you know what they recommend? They actually recommend that you move to BC, wait the 6 months so that you can be covered by pharmacare. So we have great inequities. There's huge challenges in healthcare. One is privatization. Another is the fact that there are growing inequities within the system in terms of province to province, but also within provinces. And thirdly, of course, is the Conservative government itself. So I hope very much that healthcare is going to be a big issue in the next federal election. I really believe that we have to get out there and we have to talk about mental health. You know, this is something that you know, often there's not a lot of public discussion about. It's a huge issue, whether it's in the workplace, whether it's in our local communities, the stigma that's attached, the fact that there's lack of resources. And in fact, if I'm really pushed and I have to respond to, you know, when people say, well, is there anything that Stephen Harper did that was okay? Is there anything? And I actually do have one thing, and that is that he did establish the Mental Health Commission of Canada, which is a national body, and they've actually done some very good work on looking at mental health issues across the country. But you look at the health status of First Nations and Inuit and Métis people. I mean, it is appalling that in a country as wealthy as Canada, we have people who still don't have access to basic primary health care. I mean, it is just totally unacceptable. So this, again, is another key outcome that has to be met. So I did want to just say a little bit about healthcare because I believe in it passionately, and even though I'm not the critic anymore, because I'm not running again, and Mr. Mulcair needed to bring forward new people, and in fact I'm delighted to say, if you don't know already, that the new healthcare critic for the NDP federally is Murray Rankin, who's our member of Parliament. Really terrific, and I already wrote to Murray and said, you know what, I'm with you 100%, I'll tell you everything I know, I'll give you all the files, all the contacts, and I'm really glad that he's going to be taking it up. So this will be something that you'll see it for the NDP in the election, along with other issues. That I'm very proud that Mr. Mulcair has talked about minimum wage, about childcare, about rolling back this ridiculous, absurd proposal that Harper has not just put forward, but said he's going to do, which is to increase the age of eligibility for OAS from 65 to 67, the income splitting that Larry spoke of, not to mention all of the environmental, I mean, there's just so many things, One of the things that I'm going to be watching very closely, and I hope to be working in different ways, is to ensure that finally Canada re-establishes itself as a country that has a national housing program. As wealthy as Canada, that we have no national housing program. We have bits and pieces. We got some money for homelessness, but the national housing programs that we had have all gone. They all disappeared under Paul Martin when he was cutting the deficit. I mean, basically that was done on the backs of poor people. That's what happened. And I mean, I could go on and on here, but the other sort of underlying issue that's really facing us in this country is, there are democratic issues. There's the voter suppression with this awful voting bill. But the other sort of thing that kind of is running a parallel course that is very frightening is the growing income inequality in Canada. There's lots of reports out there. The CCPA does fabulous reports, both here in BC and nationally, on income inequality. All the numbers are there. And basically, we're creating a society, well, we're not the ones creating it, but it's being created, a society where the gap between those in the lowest quintile, the people who are the poorest and the people of the wealthiest, that gap is growing and growing. And that's why people who do see themselves as middle class think, hey, what, like my income isn't any better than it was a decade ago. In fact, if anything, it's dropping. Or I'm working harder, or I'm having to work 2 jobs, or whatever it might be. And so income inequality is the other major factor that is a transformative thing that's taking place in our society. And these are issues that we have to grapple with as New Democrats. We have the analysis. We've got all the reports up the yin-yang. We've done the work. And now it's a matter of, I think, standing before people and saying, there is a choice in this country. There is a choice about how we go forward. And there is a choice about what kind of government we have. And I'll end on this note. I'm heading back to Ottawa tomorrow. The House opens again on Monday. And I want to tell you that I am so proud of the caucus that we have, of almost 100 people. It's the most diverse caucus probably in the history of Canada. We have 41% women in our caucus. The most incredible number of young people. And I remember when some of those young people, you know what, yeah, it's true, some of them did not expect to be elected. But they did, they got elected, and you know what, they jumped, you know, the first issue they faced when they got to Parliament was the back to work legislation for Canada Post. That hit us in June of 2011, right when, it was June 2011, right when we went back after the election. It was Jack's last few days, and I watched these young people. They had never been in the House of Commons before. I watched them in what we call the opposition lobby, because we were going 24 hours a day to try and, you know, stop this legislation. And they were all writing speeches on their laptops. They were doing research. They'd never even spoken in the House before. And I sat there and I was like, oh my God, like these folks are incredible. Like they're just jumping in. They're just seizing the moment. And their presence, not only in our caucus, but also in the House, has really changed the dynamic. You know, Parliament doesn't reflect the people of Canada. If we had proportional representation, we would have a much Craig Scott, who followed Jack Layton in Toronto Danforth. He's a constitutional lawyer. I was just at his nomination meeting a week or so ago. He's led the campaign for the NDP on proportional representation. And what he says is that he believes that this will be the last unfair election that we have in Canada. Democratize elections, you know, and throw off this horrible voter suppression methods that Harper has employed. We have to bring in proportional representation, and we have to ensure the diversity not only within our parliament, not only within our party, but also within Parliament. And I see that in the NDP caucus, and I see those young people, and I see our Aboriginal members, and I see our LGBTQ members, and I see the number of women in our caucus, and I think, okay, this is all good. This is good. This is who we are, and this is what we are meant to do, and where we're meant to be. So I hope that you will keep that feeling too. And, you know, there'll be a big campaign nationally and all of that kind of stuff, but I really believe, and I hate to use these kind of terms, I learned it from Olivia Chow. She always talks about ground war, ground game. And that's what it's going to be. It's going to be riding by riding. We have some pretty amazing candidates across the country. You have Larry here, who is a very fine candidate. He's local, he knows the issues, he's very committed, he's going to work very hard, just like Terry did. And our job is to support him. So the Sunshine Coast, I'll tell you, it's a hotbed of radicals. Get out there and do your bit, because it really does make a difference. Thank you very much.